Welcome to Health Live at Seniors today. We are delighted to have here with us Dr. Chandrasekhar Kulkarni to conduct the session today. And the topic that he has is common heart ailments, familial traits, and advantages of earlier diagnosis. Before I invite him, I'm going to just give a short introduction. In fact, it's rather short because the actual introduction was really long. We could have completed the entire 40-minute time that we have, but I'll just introduce him. So Dr. Kulkarni is Senior Cardiovascular and Thoracic Surgeon, and he is also doing heart and lung transplant. He's a robotic heart surgeon at the Nanavati Max Super Speciality Hospital. He is a fellow of cardiothoracic surgery from the Green Lane Hospital in New Zealand. He is an MCH in cardiovascular and thoracic from KEM Hospital, and an MS in general surgery from the Tata Memorial Hospital, a DNB in general surgery from the Royal College of Surgeons in Edinburgh, and an MBBS from the LTMM College of and Hospital, which is better known as the Sion Hospital. He has been, other than before Nanavati Hospital, chief consultant of cardiothoracic surgery and program head of heart and lung transplant in minimally invasive and robotic cardiac surgery at the Global Hospital in Mumbai, which is now Glen Eagles. He was consultant cardiac surgery at the Pirandani Hospital in Powai, and he was also for around 8 years at the Jahangir Hospital in Pune. He has several accomplishments: a gold medal in cardiovascular and thoracic surgery from Mumbai University, also a general surgeon from a gold medal in general surgery from the Mumbai University, and in pharmacology as well. He has a long list of expertise that he have, but the very fact that he is holding the top job at Nanavati Max Hospital and doing some amazing stuff in the past should suffice. So welcome to Health Live at Seniors today, Dr. Kulkarni.
Thank you. Thanks a lot, Mr. Maheshwari. It is a pleasure. And obviously, the accolades obviously are something which is a reflection of my parents and obviously my teachers in all this time. And like what we say, when we stand on the shoulders of giants, we can see a bit more further. That's what is sort of inspiring us to go further and do this into a challenging view, where we are now slowly introduced even robotic heart surgery to the city of Mumbai. So obviously, this is just an introduction, and then but the main part of this talk today will be for preventive cardiology, because that's what our emphasis will be today. And we would like to just share our insight and views about the same. So without much thing, I'll just start showing my screen, and hopefully we'll start.
Yeah, and even as the screen is shared, those of you who have questions, please put them in the Q&A tab, as always, with your age and gender, so that Dr. Kulkarni could give a consider. Over to you, Doctor.
Sure, thank you. I hope my audio is clear and everything is great.
Absolutely clear, thanks.
You can see my slides. And
yes.
Yes, great. So this is something which we, like for any webinar, it's always very essential to understand that what we are trying to do is to make sure that we're going to have a sort of a wellness message. But at the same time, it has to be with some amount of humor, unless and until it sort of strikes the person in his head that this is something very new or something very old. Depending upon what choices we make and how do we sort of get old gracefully. So the idea, everybody knows that at some point of time, our lives are going to end. Only question is, what is the quality of life we are going to enjoy, and what sort of things we need to do so in order to make sure that we are self-sufficient, not very dependent on our children or some other caregivers. With the current scenario where most of the parents have their children somewhere outside India, it's always a very important thing that we need to understand what's really wrong, and denial is not a part of it. So that's where early diagnosis and understanding of a treatment and the treatment protocol comes in view. At the same time, it makes sure that whatever sort of treatment has been advised, there have been reasons why this particular treatment has advised. And it's always a sort of a tailored approach to a person, that why a particular incidence of treatment or medication or procedure or surgery has been advised. And usually following this to the hilt makes a big difference. So like what we said earlier, humor does make it important for everybody to understand, but it is equally true that if we are at the receiving end of the humor, obviously none of us are actually very happy with it. And that's where it is important for us, at least in heart matters, to understand what's really the part we need to be careful of. And at the same time, how do we learn from others before we sort of end up ourselves on a patient side. Nobody, not even a doctor, will be very comfortable to be on a patient side, but that's where it starts. Like what they say, charity begins at home. And that's where we are at this point of time, that our home, that is India, is number one, or what we say is the gold medal position for having heart disease. And this was predicted by the famous journal called Lancet in 2008. So I think we have become the capital of diabetes and heart disease since maybe late 2020, early 2020 or something of that sort. But it was predicted almost 12, 15 years ago that the amount of heart disease in India will be very, very high as compared to the global population. And it is also seen that we get this heart disease or we get this diabetes a bit very, very early as compared to the Western, or even as you compare to Polynesians or even Japanese descent people. And we have the highest incidence of diabetes by the time we sort of see the average age of people coming to us for heart disease. And this has been true even for people who have migrated to Western countries, even say around 2 or 3 generations ahead. And they might have obviously have had adapted newer or the Western sort of lifestyle, what we say, but still they are still at risk at developing the disease earlier and definitely more graver than the local population out there. That's the reason. The reason for us is what is called as Indianness. So our genetics have already loaded the gun. What pulls the trigger is the lifestyle. Change of lifestyle, which we are seeing nowadays, like we are getting more and more westernized in our lifestyle. So that is actually adding fuel to the fire. The fire was already burning in our tummies because of our genetics. The reason for this, we'll just discuss a bit later. But at the same time, what is being added to this is stress and also smoking, which is now going up quite a lot. Earlier in my days, when I was learning in MBBS, it was told to us that generally women are protected from heart disease because of the hormones. But nowadays we are seeing that even younger women, even below 45 years, are having problems with heart. And now, especially so with some of them who have started to have smoking with a very large number. Like in my young days, obviously, we never used to see women smoking except in the rural areas. But now it's a quite common thing in urban areas too, and even young people in the colleges are also very much into this. So that's where we need to understand that any heart disease usually which presents can be of generally the 3 types. One is called as a structural heart disease, which is something very problematic with the valves or the structure of the heart. And second is the functional heart disease. So the most important reason for functional heart disease is what we call as a block in the heart. So a person can either present with a heart attack or a cardiac arrest or anginal pain. So what's so different in all these things? We have seen classically heart attacks presenting by asymptomatic people suddenly having a chest pain, and then they feel uneasy and they rush to a doctor. An ECG is taken, and or nowadays obviously we have round the clock blood tests also which diagnose a heart attack. And the person is then reporting to the hospital in what is called as a golden hour. If suppose this heart attack is very significant or very high, then the patient can suffer what is called as a cardiac arrest. The most important difference between in having a heart attack and a cardiac arrest is something where that the patient's consciousness is not lost during the heart attack. He's very much aware. He can complain. He can tell, I've got this problem. I'm not able to breathe or something of that sort. Whereas in cardiac arrest, the person just becomes unresponsive. We have seen few gym videos coming out from various sources on social media where person might be just coming off the gym. He must have just been sitting at the back after an exercise and suddenly becomes completely unresponsive and he just loses himself. That's something called as a cardiac arrest. So the main difference is in a place where there is significant heart dysfunction, which could be again electrical or mechanical. So when we say electrical, there could be some sort of electrical abnormal activity in the heart, which has suddenly raised your heart rate from, say, a normal of 80 to around 230, 240, 250, where your blood circulation is hampered. The heart itself is not able to contract very well. It is not able to generate the blood pressure, and therefore there is reduction of blood pressure reaching to the brain, and person just passes out. That's the most important reason for a cardiac arrest. Other mechanical problem obviously could be a very significant and a rapid onset block in one of the major arteries of the heart, where a very global sort of involvement of critical reduction of blood supply happens in a very fraction of a second. That itself can trigger significant reduction of blood supply, and the heart itself doesn't get adequate blood to function for the next or the coming on beats. And this particular positive feedback cycle where less blood, less movement of heart, less blood again, and less contraction of the heart, this sort of goes into a sort of a tailspin and person just suffers a cardiac arrest. So this is something which we have been most dreadful of, because at least a heart attack does give you a couple of hours to reach to a hospital or a nursing home very close by, where there can be some sort of a treatment and diagnosis for the same. But whereas a cardiac arrest is a very shocking incident, and people who have been known, so-called athletes, gym trainers, or even cyclists who could cycle 100 kilometers in a day or something, could have a very major problem leading to cardiac arrest. A very third but very significantly present is also called as anginal pain. Now, anginal pain is very common in people who are not diabetics. In diabetics, we have seen that the chest pain, which we classically say as the pain which is in the chest after exercise or becoming a bit when somebody is anxious, that is usually absent in diabetics. So it is very essential to understand that a person who is a diabetic may not actually have what is called as a classical chest pain. He can just progress to the next step of problem, where he might just get breathless, or his easy fatigability, that's the word we use, or he just loses his daily exercise distance. He reduces on his say the speed of exercise. He's not able to climb a couple of stairs on his own, or he has to wait, and he gets a bit breathless at the end. So here chest pain or breathlessness are considered as equivalent, and this is a more chronic problem. The better part of it is obviously it gives you more time for response, as well as it gives you time to understand what's the problem. Good diagnosis can definitely lead to a proper solution within no time. So all of this generally happens because there are some problems with the circulation, that is the blood supply to the heart. So as we know, the heart has started to beat maybe say in the 7th or the 8th week of pregnancy and gestation, when we were in our mother's body, and it almost goes off till the end of our journey. There, obviously, if somebody is working continuously, it needs money. Money is in the form of oxygen, money in the form of glucose, money in the form of good blood nutrients, which comes with every beat. Now, we need to understand that the heart is a very unique organ which does not receive blood supply throughout the time of beating. When there are in every heartbeat, there are two parts. One is a contraction, one is a relaxation. Contraction is the phase when the main pumping chambers of the heart, namely what are called as the ventricles, are pushing the blood out of the system. During the time of contraction, the arrangement of the heart is such a way that the blood vessels and the muscle fibers are sort of right angles to each other. And obviously the blood vessels are the one which are the weaker, muscle fibers are the stronger. So obviously when the strong one compresses the weak one has to stop. there is no blood flow to the muscle of the heart when the heart is contracting. So that what is approximately 30% of the time. So when we have been completely living, 30% of the time, or 30 years out of 100 years, your heart is never getting a drop of blood supply for those particular time. So what is needed is the rest 70% of the time is more than efficiently required, so as to fill up the demand supply issue of the 30%, and most important, also to make adequate preparation for the next 30%. That's where having very big arteries and having clean arteries is very essential. So what we have seen is the blockages do find over a period of time, like the lower half of the page, you can see that most of the blockages generally start from the second decade or so. Gradual increase in the reduction of the blood supply happens because there is gradual buildup of the block. So how do these blocks start? So these generally start with a small injury on the in the internal surface of the heart, in a heart vessel. So we can liken it to something like a road. We can see that most of our roads, when they're completely new and clean, they hardly have a crack. But due to various problems like weather or wear and tear, or maybe say improper construction techniques, there could be small tears in the on the tar of the road, which is then there are lots of vehicles which pass over that particular area, weakening it further. Then it forms a pothole, and then it forms a very big sort of a crater. The same analogy we can use in the blood vessel. The blood vessel is like a highway. There is initially small stress fractures happening at the internal surface of the heart arteries, and those allow the seepage of cholesterol, sugar, blood elements, some amount of proteins inside the below in the lower layers of the heart arteries. And that's where this particular area starts growing into the lumen, because obviously the external surface of the artery is much more thicker and stronger. So obviously the entire debris will start growing inwards. And as it starts growing inwards, there is entry of calcium. So many people have seen that they do something called as calcium scores. As a sort of a calcium scan of the heart, just to see for blockages. When there is calcium, it is actually the late part of the blockage. Most of the early blockages are what is called as soft plaques. They are only made up of cholesterol. They are made up of a bit of sugar, a bit of platelets, and some amount of dead blood cells in those areas. So whenever a calcification happens, it's actually a long-standing disease. It all tells you about the history of the problem. But the very fact that unless and until this particular block is stable, only then it will lead to calcium. So certain times where patients who are, say, younger, say around 40, 45 years of age, they still have less amount of calcium in them. And that's where there is the soft plaque, which we call as the unstable plaque. So classically, what happens is when there is sudden increase in the blood pressure or sudden anxiety or some sort of depression, at that point of time, the stickiness of the platelets increase, or even we have seen that certain patients who are exposed to high stressful situations like continuous adrenaline in the situation, could be even a very significantly bad time of the person, professional stress, family stress, or even stress from gaming. Those people have had sudden increase in the clogging of the arteries because of the stickiness of the plaque. So you have around 30 to 40, 50% of soft plaque out there. And this rest of the 50% is clogged within no time, within a matter of minutes. And that's what we call as an acute heart attack. People who are fortunate enough that there is gradual increase in the percentage of blockage, they present with something called as anginal pain or breathlessness, like what we discussed earlier. People who have this sudden explosive increase in the remaining 40, 50% of plaque, and that's where the people suffer from a heart attack. So these two things are part of manifestation of the same spectrum of disease. Obviously, which person will manifest what is left to chance. It is nobody can sort of control. And hence, it is very essential that people who have some sort of problems should be very, very aware of developing any heart disease. So this is exactly what we had sort of discussed. It is sort of like how the plaque starts growing into the lumen. And mind you, it is going to be a circumferential problem. Sometimes it is also a very it could not be very equally across. It could be in one particular area, but what it does is reduction of the diameter of the artery. So we all know that the pi r square, so reduction of the area, cross-section area of the tube, when it happens by around 50%, that sort of gives an idea of reduction of area by 70%, and that's where the major problems start. And that could be the one reason where more low amount of dysfunction can start creeping in, and patients can directly present also with something like an old heart attack where things have not been that bad, but we just find it on dysfunction on a 2D echo, whatever we do. So like what we have discussed, most of the reasons for the problem are there. So genetics is a major problem in Indian families. We have seen families without all of these problems like hypertension, diabetes, stress, sleeplessness, and some amount of lots of adrenaline in the system, smoking, major problem as such. But still, these add fuel to fire. So what is the major problem is a person or a family genetics is most important. And all of these add a bit more of dash to this, increasing the problem. And hence, such patients can present either in the first half of life. The ones who are fortunate with the genetic part, they will present a bit later in the life. So out of the lot, presently what we are seeing in the last few couple of decades is that stress is the one which is giving rise to most of these problems. So younger and younger people, even at the age of say 28, 30, we have found them, they are having multiple blockages. I personally have operated on few of them, close to around 25 to 38, also 25 to 28 also. There are also certain reasons for these people to have the problem. And one of the main reasons in Indians is what we were calling earlier is called as a metabolic syndrome. Obviously, I would not like to discredit anything out there, but this is just one of the important QSR restaurants which we have nowadays, and we have seen a lot of access to all of these from younger generations also. That's where a problem comes, which is called as metabolic syndrome. This is very classical in Indian population, where there is good amount of central obesity, there is hypertension, there is diabetes, there is high triglycerides. So when we do a cholesterol check, we also see what are the triglycerides. Triglycerides are the basic fat molecules which are absorbed by the body. So that means any fat which we have is taken and broken down by digestive process. Triglycerides are across the membrane. Only triglycerides can be absorbed by the body. Rest of the complex fats are just passed down. They cannot be done. So the higher amount of triglycerides show that there is higher concentration of concentration of fats in the diet. And it is also to be known that excess of fructose is a sugar which is present in fruits, and also say even sugar which we have, it is sucrose. The normal common sugar which we use is actually sucrose, which is a combination of one fructose and one glucose molecule. The fructose is not able to be sort of metabolized by the liver, which is the main factory of the body. So any excess amount of fructose or glucose goes into a triglyceride molecule. That's what the liver does. So here, obviously, there could be dietary absorption of triglycerides, or if a person is having good amount of sugar in the body, or his diet is very high in the quantity of sugar, there it could be sort of changed into triglycerides by the body. The other thing which we also notice in a metabolic syndrome is less amount of good cholesterol. So when we see a lipid profile, we also see what is called as a HDL. H for high, DL is density lipoprotein. So HDL cholesterol is the good cholesterol. LDL cholesterol, the low density lipoprotein, is the bad cholesterol. So most of us are low in the good part, therefore less of prevention, and this could be the reason for what is going to follow later. Moment we have this metabolic syndrome, the metabolic syndrome acts at various levels. It acts on the pancreas, increasing the resistance. It acts on the muscle. It causes protein loss and protein damage. It acts on the liver because of the excess amount of triglycerides and the excess amount of sugar. There is fattening of the liver. So if such a person goes and does his sonography, it will be classically reported as grade 1 or grade 2 fatty liver. And at the same time, like what we discussed, the small fractures of the blood vessels, there could be sort of a deposition of this particular triglycerides, the sugar, the cholesterol, everything happening, and that can lead to blockages in this system. Mind you, this particular blockages can happen everywhere, in the brain, in the kidney, in the heart, everywhere. So when we are talking about a metabolic syndrome, this will sort of act all around. It could also happen to your eyes, which have got very fine blood vessels. It could happen to your legs, where again the combination of diabetes and blockages of the heart can blockage of the vessels to the legs can always give rise to something like gangrene. So having diabetes in the system is one of the most important reasons why people develop heart as well as vascular disease. And the reason, obviously, like what we have explained out here in Indians, is what is called as a metabolic syndrome, which causes dysfunction of the pancreas, increasing the insulin resistance. Work well, there is more amount of sugar in the blood system, which again will be sort of channelized into deposits into the heart arteries. So that's where importance of identification of metabolic syndrome and taking care of this. So when do we start taking care of ourselves? So here is we need to identify how are we as a identification of risk factor. So how is our genetic history? Whether we have any siblings or any uncles or any aunts, both sides, mom's side and dad's side, having family history, whether it is a significant family history. People may say, I had one of my relative having a problem at the age of 75. That's absolutely okay. But somebody who has got a problem at the age of 50 or lesser. So what is a problem? Identified heart attack, identified history of stroke or paralysis, identified history of unexplained diabetes, or say kidney disease. This counts as a major family history. Such people are the people who should ideally go for identification of risk factors and whether how much they have got into them. Doing a simple screen like what we talked about, the creatinine, the kidney function, the liver function, sonography of the abdomen, doing a blood checkup for cholesterol, the level of HDL and the triglycerides and the LDL. And in certain patients, we also see what is called as a homocysteine levels. We see what are the B12 levels. We see what are the D3, that is the vitamin D levels. In certain patients, we also see what is called as the HSCRP, which is an inflammatory marker. Like when we were talking about the inflammation of the on the top right side, we have seen vascular inflammation and atherosclerosis, which is basically the formation of blockages is sort of because of inflammation. So that's where these people might have HSCRP levels on the higher side. And in the patients who are very, very significantly say having all of this positive, the next thing to do is a coronary calcium. Obviously, a person will be also going for a stress test or a treadmill test, a 2D echo to see if there is any erstwhile history of heart problems, or if there is any other associated problems of the structure of the heart. So all of this put together, that is going to guide us into what is the treatment protocols and following for this. So this is for a general person, but what happens for a person who is just hypertension or diabetes? We'll just come to that. Before that, we'll just talk about what is the most important reason for developing all a metabolic syndrome. Genetics, obviously, yes, we cannot change our genetics, but what we can change is our sedentary behavior. It has been shown now that sitting just for around 7 to 8 hours a day is equally problematic as having diabetes, especially for developing heart disease. The reasons for that, obviously, all of the sedentary time, we are we are also having some amount of extra calories at that time. We're not burning those. And this is going to just go into the liver, and the liver is going to put it into the storehouse of fats, cholesterol, and a good amount of extra sugar is being loaded up into the peripheries. That's where it is very essential that physical activity itself can take care of the ill effects of prolonged sitting, or most of us nowadays have what is called as work from home or a table job, a desk job. That's where shifting from a sedentary behavior to going for a light, moderate, and vigorous exercise, like what we have discussed here, that is the most important part. So even just devoting 45 minutes of brisk walking or what is called as a moderate exercise, and at least 2 or 3 vigorous exercise sessions in a week can definitely offset all of these problems. And mind you, a person who's newly diagnosed as hypertension or diabetes, if they follow this, that is at least 35 to 40% important for them, in addition to taking the medications for some period of time. So it has been seen that people who undergo this constructive lifestyle changes, making sure that it is additional with exercise and diet, they have been able to reduce the amount of blood pressure or diabetes problem. So when we see nowadays most of the ads on social media about diabetes reversal, most of them actually talk about increasing the availability of exercise and making sure sticking to a good exercise regimen itself can take care of around 35 to 40% of the problem. Obviously, in persons with diabetes, they have to be a bit more attentive to them, and maybe at least 150 minutes per week of moderately intense physical activity is in addition to medication. So when somebody's been diagnosed as diabetes, initially they have to be controlled with medication, because nowadays there are so good medications which have come in, which can have micro level changes at the each of this vascular bed. They can also reduce the amount of weight a person can have. So depending upon their particular requirement, medications can now be tailored. In certain patients, and you can obviously go for reduction of dosage of medications. You can also go for completely being off medications by a very good amount of diet and exercise schedule. The same thing also for high blood pressure, and it is very essential to understand that the amount of salt intake in the body is one of the most important reasons for having blood pressure. So shifting from high sodium salts to low sodium salts, nowadays we get low sodium salts very much readily available in supermarkets, and at the same time reducing the amount of alcohol and smoking can go a long zone in reducing your blood pressure. Obviously, for both any person who would like to change his lifestyle habits for food, it is very essential to have less amount of cereals, more amount of pulses, more amount of say proteins. On an average, around 30% or less than 30% of your daily calories should be from carbohydrates. Around 25 to 30% should be from proteins. Less than 20% from good quality fats. So when we say good quality fats, they have to be polyunsaturated fatty acids and a very good mix of omega-3 and omega-6 fatty acids should be there. It is very essential for a very good omega-3, omega-6 ratio, especially in younger people, like who are who are planning pregnancy or even on lactation. So from the female point of view, it is very essential to be very good in protein as well as good fat intake. And the rest 20% of the food should obviously be fiber, because this is where you are going to have smooth bowel motions, and at the same time it is going to reduce the amount of the residue is going to be taken out, and it is not going to be available for absorption by the body. The last but not the least, it is also important to understand at every person who's having empty calories. When I say it is empty calories, that means alcohol, because alcohol comes with high fat food, finger food, what we normally cause, and that is usually towards the end of the day, which is straight away going into your fixed deposit of fat. Complete avoidance of alcohol is one of the most important reasons, but nowadays we see what is called as social drinking. that I would like to everybody to decide how much amount of alcohol they would like to go in for. Nothing. At the same time, it is also important to understand what is called as a glycemic index of every food. Every food has what is called as glycemic index. It is the amount of sugars which are available per 100 gram. So simple food like kurmura, which is like the most important or a simple thing like what we see from chart. If you just go and Google these particular things about glycemic index, you will learn a lot. So anything which has got less than 30 glycemic index is a good food. Anything between 30 to 50 has to be taken in moderation, and anything between beyond 50 has to be almost avoided or once in a month sort of a situation. So just for example, puffed rice or what we call as kurmura, it is glycemic index of approximately 90. So that's where we are. So we now need to go back and understand that all of this we have been consuming for the last 15, 20 years, and that's what's going to show it into our arteries at some point of time. So this SIP, which we have been doing for such a long time, is going to give us some returns, but those returns are definitely going to be negative, not the positive ones, which we generally discuss and require. And it is very essential for all of us to have this particular changes. At the same time, we would also like to discuss that there could be certain structural problems of the heart, like one is called as a electrical issues, which where certain people get something like a palpitation, some people get valvular problems, and all of these also have a very different sort of a investigation protocol. All of those cannot be directly generalized like what we do in a routine webinar like this. And most important is everybody should have a CPR training. So anybody who's active, who's sort of completely good can be a CPR person. Nowadays, we even as a hospital, we initiate a lot of CPR camps in surrounding friendly societies. So as and when you get a chance, you can at least, obviously, you can watch social media videos on CPR, sorry. But at the same time, if you can get an option of having a hands-on training with CPR, it is very, very, very essential. Use of defibrillation, use of advanced CPR techniques is the one which has to be understood for everybody today. What is called as basic life support, I'll just quickly go through is compressions, airway, and breathing. Mind you, there are certain places where we give breathe mouth-to-mouth breaths, certain places we need to avoid, but definitely attending a basic CPR will clear all our doubts. And mind you, everybody in any walk of life should at least have CPR training once in every 5 years. And yes, a healthy heart checkup should be at least once after the age of 40 and repeated after every 5 years or so. What do we do slightly differently at our hospital? We also do what is called as a robotic bypasses. We do minimal invasive surgeries. These all are certain things which we do not want you to come for. And that's why the purpose of this particular discussion, where going for identification at early places rather than having multiple blocks at a multiple period of time. And that is going to go down into what is called as a bypass or an angioplasty, where stents are going to be used to sort of open up the clogged arteries. Or sometimes when there are major problems, then the person needs to go for a bypass. So we at Nanavati Max do what is called as a minimal invasive bypass. It is like a chest pocket incision rather than a traditional long incision in the center of the chest. And it is a very nice cosmetic incision, especially for female patients, because we get the incision almost concealed, what is called as a cosmetic bypass surgery. And even through this, we use what is called as an open beating heart technique, not an open heart operation. And the functionality post-surgery is very fine. We have seen people coming to simple jobs within a couple of weeks or 3 weeks. Even robotic options are available for people who are discerning and at the same time slightly high on the body mass index, which we can make sure that these patients are doing much better. Additional to that, we also cater to valve replacements, which can be done through percutaneous methods, like what are called as a TAVR. It is a simple, just like an angioplasty. We can do valve replacements, we do valve repairs, we do operations for cardiac tumors. So these are the various problems which generally come across for as cardiac problems. So mind you, we'll just go back once again, one step back and understand that most of these problems can be identified in a very early way. And the way to do it is to have a routine checkup for your heart, either require maybe once on every 3 to 4 years if you are not symptomatic, but if you are diabetic or hypertensive, maybe even a couple of years per 2 years is a very good idea. More so if an index case in your family has had a heart problem, say around 50 years or somewhere before that. Indians, we know, are generally the ones who are lazy, especially in taking up taking up the preventive part. And here we have to be really awake, because as it is, we are number one in the world for heart disease and diabetes. A simple blood sugar checkup, a simple BP checkup every by a person who's asymptomatic can prevent further problems down the line. The other important part of having a early checkup is also it gives you very good clearance from insurance point of view, because nowadays most of our data is shared by different insurance companies, and hence it is very difficult to skip the data and make sure it is very essential for us to make sure that we have a clean record and understanding what is covered, when it is covered, what are the age, what is the age of the policy before they are going to give us insurance coverage and things like that. So going for a clear-cut understanding of one's own health profile as early as possible goes a very long way as such. So I think I've come to the end of my presentation. If we have any sort of questions, that will be appreciated.
Thank you, Doctor. Thank you very much. I think a very detailed and very good presentation. I'll just wait. Can you stop the screen share if you can?
Yes, please.
Yeah, great. Thank you. So, yeah, there are a few questions that have come in. One is from Mr. Bharat Mehta, who is 67. He says he has had an operation for angioplasty with one stent in September 2020. His question is, what precaution should a senior citizen have to do to avoid further damage to the heart?
Yeah, so obviously it is most important to understand, do you have some sort of problems like blood pressure and diabetes? It is very essential if you had it around now to 2020, like at least 3 or 4 years earlier. So it's very essential to have a follow-up of your condition, heart condition, maybe get a stress test and a 2D echo done for yourself. 2D echo will show if your heart function has improved over the last couple of times or it has gone down. So it will sort of give you a reference for it. And a stress test will show you whether you have got any other particular problem in any other system or even this particular system. So we have to all understand that the blood which was going through the previous arteries caused the block. Even now putting the stent also, if we do not change the type of blood going in, you always have a chance of going into the same scenario. So therefore, optimizing your treatment, most likely you will be on some blood thinners, you will also be on some cholesterol lowering agents, and at the same time, treatment of your blood pressure and of your diabetes, if at all it is there. That is a very important part for it as such. So yes, a regular checkup with your friendly cardiologist, maybe a stress test now, and a 2D echo will solve most of your problems.
We have a question from Mr. Ravi Bala.
Yeah.
He's asked it in Hindi and he requests for an answer in Hindi.
Yeah, that's fine. Yeah.
तो मैंने लिपिड प्रोफाइल करवाया था, ट्राइग्लिसराइड 301 है, गुड कोलेस्ट्रॉल कम है, ट्राइग्लिसराइड कम करने के लिए उपाय बताइए।
बिल्कुल, तो जैसे मैंने बताया आपको, ट्राइग्लिसराइड्स ये छोटे से छोटे फैट के कण रहते हैं जिसे हम एब्जॉर्ब कर सकते हैं। सो ये आने अपने शरीर के अंदर बढ़ने का कारण दो ही है। एक मतलब हम बाहर से कुछ खा रहे हैं जिसमें से बहुत सारा फैट है। सो कॉमन चीज जो हम खाते हैं जैसे बटर, चीज, मेयोने या फिर से घी, तेल, ये सब चीज का जो एक जो तले हुए चीज है ये हमें फ्राइड फूड्स इसे हम कहते हैं, फिंगर फूड्स जो कहते हैं, ये इसे हमें डेफिनेटली कम करना है. घी इज अ वेरी मेजर पार्ट ऑफ ट्राइग्लिसराइड्स बिकॉज घी इज एक्चुअली अ सिंपल फॉर्म ऑफ ये, तो उसमें ट्राइग्लिसराइड सबसे ज्यादा रहते हैं. सो नॉर्मली फुल्का खाना जिसमें आप रोटी में घी नहीं मिलाना है आपको, ये छोटी छोटी चीजें आपको चेंज करनी है. दिन में ज्यादा से ज्यादा एक आदमी ने 2 बड़े चम्मच, जो हम जिसे हम टेबल स्पून कहते हैं, उतना ही तेल खाना चाहिए दिन में. तो अगर हमने एक समोसा खा लिया फॉर एग्जाम्पल, तो हो गया काम, तो वहीं पे खत्म हो गया. सो ये सब चीज, जैसे मैंने आपको बताया था कि फैट परसेंटेज हर एक चीज का, जैसे हम ग्लाइसेमिक इंडेक्स हर एक खाने का देखते हैं, वैसे ही हर एक चीज का फैट परसेंटेज आजकल हमें लेबल पे मिल सकता है. तो ये आप फाइंड आउट कर लीजिए कि आपका जो इनटेक आ रहा है वो कहाँ से आ रहा है, और उसको कम करने के लिए डाइट तो आपको रखना ही पड़ेगा. लेकिन अगर 300 अगर आपके ट्राइग्लिसराइड्स है, तो मेरे हिसाब से आपको उसके लिए मेडिकेशन लेना बहुत इंपॉर्टेंट और आवश्यक हो जाता है. बिकॉज जब तक ये कम डाइट से कंट्रोल होने में कम से कम 6-8 महीने लग जाएंगे, तो आपको डेफिनेटली अभी मेडिकेशन लेके उसे कम, डेफिनेटली कम करना है. और जब आपने पूछा कि एचडीएल कम है, उसके लिए आपको बढ़ाने के लिए भी मेडिकेशन अवेलेबल है. सो कॉमनली हम जो रोजुवास्टैटिन या करके जो मेडिकेशन हम यूज करते हैं स्टैटिन कोलेस्ट्रॉल के लिए, उससे एचडीएल थोड़ा बढ़ता है. खाने में आपको 1 या 2 अखरोट खाने हैं, या फिर आपको थोड़े से फ्लैक्सीड, जैसे हम मराठी में उसे जवस कहते हैं, आई एम नॉट श्योर इन हिंदी में क्या कहते हैं, फ्लैक्सीड इज द वर्ड इन इन इंग्लिश, जिसे जो आप खाने से आपका ओमेगा 3 ओमेगा 6 का रेशियो भी ठीक ठाक आ जाएगा, जिससे आपका एचडीएल बढ़ने की चांसेस है. Exercise is another way of increasing HDL. So that is one thing which everybody should start.
Thank you, doctor. We have a question from Shailaja Ganguly, who asks, what is a silent heart attack?
Yeah, so silent heart attack is something like what we say, that there could be a possibility that certain people have had gradual increase in the heart blockages, where say for example somebody might have from say 70 to 80 to 90 to 100%, and at the same time, because of it could be an unimportant artery or a small artery, a very small area of the heart was sort of diagnosed to have heart attack. But this diagnosis happens in retrospect, it doesn't happen in the way, because somehow it gets sort of compensated by the person. So once, say, suppose if I go for a 2D echo today and my heart function is say around 40%, that means I have reduced by 33% over a base of 60. That's where I must have got a silent heart attack. Silent heart attack is more common in diabetics, like what I explained earlier. They don't get the classical chest pain, they get only symptoms of breathlessness. Or else very common that it could happen towards the lower surface of the heart, what is called as the inferior border of the heart, which is in conjunction with the stomach. So किसी किसी को ऐसे लगता है कि जैसे पेट में प्रॉब्लम है, लेकिन एक्चुअली प्रॉब्लम हार्ट का हो सकता है, जैसे गैस होना या बहुत एसिडिटी होना, दैट आल्सो कैन बी mimicked as a heart attack in certain patients. So that's where people may not just understand that this was actually a heart attack, but comes later in a ECG or a 2D echo.
Doctor, we have a question now. We've had a question in Hindi. Now we have a question in Marathi. There's Doctor Numala Marathi.
Oh.
You understand Marathi, so I'm going to ask a question in Marathi. मी आहे ज्याला लोक म्हणतात एक चिंताग्रस्त स्वभावाच्या. मी लवकर नर्वस होतो. माझ्या his question is, will his children, माझ्या मुलाची असाच चिंताग्रस्त स्वभाव असू शकतो असं तुम्हाला वाटतंय काय?
हे सांगणं जरासं डिफिकल्ट आहे. चिंताग्रस्त स्वभाव असणं ह्याच्यानी ऑब्व्हियसली काही लोकांना हार्टचा प्रॉब्लेम येऊ शकतो, कारण जेवढे जास्ती आपण चिंता करतो तेवढी आपलं ब्लड प्रेशर वाढतं, ऍड्रिनालिन वाढतं, आणि त्याच्यानी कंटिन्युअसली हृदयाची धडधड जी असते ही जास्ती वेळ होत असते. त्यामुळे मग डिमांड सप्लायचा इश्यू जास्ती लवकर होऊ शकतो. आता तुमच्या मुलांमध्ये तो होईल का नाही हे सांगणं थोडंसं डिफिकल्ट आहे. आपण नेहमी असं बघितलेलं आहे की प्रत्येका घरामध्ये प्रत्येक माणसाचा स्वभाव वेगळा असतो. त्यांचं एखाद्याच्या माणसाशी किंवा एखाद्याच्या परिस्थितीशी जुळवून घेण्याची प्रक्रिया पण वेगळी असते, त्याचबरोबर त्याला रिॲक्ट करण्याची प्रक्रिया पण कम्प्लिटली वेगळी असते. अशा लोकांमध्ये इट इज व्हेरी डिफिकल्ट. इन अ फॅमिली ऑफ 4 वी हॅव सीन पीपल हॅव्हिंग व्हेरी डिफरंट पर्सनॅलिटी. सो इट इज पर्सनॅलिटी इज नॉट जेनेटिक. हार्ट डिसीज कॅन बी.
Doctor, we have crossed the line. Can we just take 5 more minutes? And
yes, please.
So this is a question from Mr. Lakshmi Narayan, who is 69, living in Bangalore.
Yeah.
In 2019, his weight was 105. And from Jan 2020, he started following intermittent fasting, kilometers of walk that brought his weight down to 85 and sugar BP under complete control. From 2023, his second half, he observed that brisk walking was causing pain in the right. It was in the right side of the chest was tightening up, and hence he met the doctor. All tests were done, nothing was visible. Heart was working at 60 plus percent, which was also good for a 68-year-old. He suggested to reduce my speed of walking, and as against 6.5, he now come to 5.5 kilometers per hour. Is this age related, or as I would like to walk the earlier pace? And now he is weighing 88 kgs.
So I would suggest that you undergo something like a CT angio, which will just take care of all these problems, because unless and until you have a undiagnosed, once we do a diagnosis by a CT angio that there are no blockages in your heart, then we can definitely go up into the zone of 6.5, which you would like to go. But without understanding and without diagnosis, if you sort of go up, having a tightness of the chest is exactly what we call as angina. So this is a very positive sign. So since you have had some amount of obesity issues earlier, there could be a problem where there could be some amount of blockages in the heart. So I would suggest a CT angio with you. If it is good, then you can go back to your own routine without any problems.
Another exercise-related thing, this is from Mr. S.C. Koti. He's 73. Of late in the last 5-6 months, I've observed that my walking pace has come down substantially. Does it indicate a heart condition? He walks daily 5 to 6 kilometers. Earlier, about 2-3 years back, he used to run the half marathon.
Okay. So it's almost the same situation as Mr. Jay. So therefore, the earlier person, where I think we need to just make sure that your age, if you really would like to go back into that zone, and if your heart is restricting it, it is sort of a soft sign. So doing a CT angio, that is a coronary angio with a CT scan, is the simplest way of taking away this problem, and that can sort of give an answer to you whether you can go back to your own situations.
Last, this is from Mr. Ajay Khetapal. He says he's an active person, was prescribed rosuvastatin 20 mg per day and a clopidogrel
75. Yeah.
Insulin checkup done in 2017. 30 to 40% blockage revealed in 2 heart arteries. Can an improvement in diet and exercise regime plus annual checkup showing normal readings help now?
Yeah. So we have seen that people who have diagnosed heart disease should be on some sort of blood thinners. Whether they're on, say, if you are really stable for the last 7 years, you don't have any other issues, you can sort of come down from clopidogrel to aspirin with your advice of your doctor who has prescribed it. But it is very essential to be having very regular checkups of your lipid profile, because if you're on rosuvastatin, that means you had at some point of time some cholesterol issues. If at all they are good now, you can reduce from 20 to 10 also, depending upon how things are with your particular reports.
Right. Doctor, one last question. I'm sorry. This is from Suresh, who's 72. 2 years back, he underwent a valve replacement. No diabetes, BP of 140/80. Blood thinning tablet, he takes acetron 2221. What precautions should he take to avoid further calcification?
Like what we discussed earlier, calcification is reaction to the heart arteries over a period of time. What I understand, at your age of 72, most likely you must have had what is called as an aortic valve replacement. So that is like you have already undergone the operation. So it's a very presently you just have to continue with your medications. It is usually most of these valves, whenever we replace them, they last for at least 15 to 17 years without any problems nowadays, whatever we get. So having a low amount of say fat foods, making sure that your lipid profile is very good. You might have to be on some lipid lowering agents, and also blood thinner like ecosprin will definitely help in adding reducing the chances of calcification further.
Great. Thank you very much, doctor, for answering so many questions. I'm sure there are a few more which I did answer, which was not sticking to the topic on hand. amazing, very detailed presentation that you gave, and plus quite a few questions answered. As always, the presentation the doctor gave and this entire video will be up on our website on Monday evening, so you can have a look at that. And if you missed out on some information given, please do that. Do remember that the webinars like these are advisory in nature. You must interact with the doctor yourself for clinical examination and for real advice. And of course, you can also interact with Dr. Chandrasekhar Kulkarni at the Nanavati Max Hospital for a teleconsult if you're not in the city.
Absolutely.
Of Mumbai. Those of you who would like to pre-register for our webinars, please do that. The topic that we've looked at is familial history. We're going one step ahead, and we're looking at how genetic issues and genetic testing for cancer is an issue. And we're going to have Dr. Mansi Munshi, who's going to be taking a session next Saturday. So please be there, those of you who would like to look at that. We just felt, doctor, that this issue of family history and hereditary, etc., was very important.
Yes.
And it was, good to have you today, as well as, our sessions. So next week we'll be there. And once again, thank you very much, Dr. Kulkarni, for being there. Thank you to the
Nanavati
for facilitating this. We'll be back once again. As always, do remember, there is the Evergreen Club, which has multiple sessions through the day. There is the Seniors Have Talent, which we are starting the 15th season from June 5th. So if somebody who sings well, who's above the age of 60, there should be. Doctor, there are quite a few, I know a lot of doctors who are into music. And
yes.
We've had somebody from Nanavati, who I remember, who's a spine surgeon. Dr. Mihir Bapat, who's a singer. I don't know about you, but we must have.
I'm a very good listener.
We must have at some point a special session with doctors.
Yes.
Thank you very much, Dr. Kulkarni, for this. And it's been a wonderful session. We'll see you again next week, next Saturday at 5 p.m.
Thank you. Thanks a lot. Great.
Subscribe now and press the bell icon. Never miss an update.